Thank you. Okay. Toddlers. Animals. Guttural animals. So you will always, on these, you're going to have keywords in the middle. So anytime I ask you, what's the keywords for toddlers?
Me.
They're 100% egocentric. So you need to picture them with a mirror that goes all the way around 360 degrees, and all they see is themselves. And what happens if you try to go over that mirror and invade on their space?
They get angry.
I ain't having you. Yeah, I don't want you. I don't, me. They cannot see another person's point of view. It is impossible. Okay. So trying to reason with them, not going to happen. Okay. Trying to explain things to them to get them to do what you want them, not going to happen. Okay. They now realize they have control over certain things, and they're going to exert that. And that is it. And screw you and everybody else. They don't like anyone else. Okay. Do not ever make eye contact. Do you understand?
Yes.
Okay. So they are 100% egocentric. Are we clear?
Yes.
So there is no rationalizing, no reasoning. Do not pick anything on an exam where it says, explain to the 2-year-old. It does not matter. They do not care. They care about themselves and what they want. And that is it. Are we clear? Okay. This is, toddlers are 12 months to 36 months. Okay. 36 months is 3 years of age. But if on an exam they put 36 months, they mean a toddler. If they put 3 years, then they mean a preschooler.
Wow. What? Okay.
So I actually included 36 months in the toddlers, but it really should be preschool. But for y'all school specifically, that's what they mean.
Okay.
Can't help you. All right. So it's basically 1 to 3 is basically where toddlers are, right? When they hit 3, though, they're going into preschool. Okay. So toddlers, keyword. Me. All right. Growth starts to slow dramatically because our first years when we have like big, giant growth spurt, right? And so that's going to slow, and they're very mobile. They are moving all over the place. They do not sit still. They are Tasmanian devils. Okay. Their adult height is 2 times their 2-year-old height. So at their 2-year visit, we multiply that times 2, and that's typically what their adult height is going to be.
Yes.
Okay. Thank you very much. All right. Erikson stage is autonomy versus shame and doubt. What does that mean?
They do what they want. Or it's like picking out their own outfits.
They do it
mismatching
themselves. Me, I do. You heard that before?
Yeah.
Okay. And if they're not able to do it themselves, or if they're not allowed to try, then they feel shame and doubt about themselves. Like, maybe I can't do this. Okay. Or maybe I shouldn't have tried. Okay. So how do I facilitate that?
Picking out their own clothes, and even if they mismatch, just
let them do it. That is the only way to give them the confidence to try. And toddlers are so egocentric that even if they mess it up, they think they nailed it.
Yeah.
They're like, I'm going to pour my own, like, they want to pour their own milk or whatever. So you give them a cup, you put it on the floor, and they pour the milk, and it goes everywhere. And they're like, Mommy, I did it. Like, they think they are amazing. Everything about themselves is absolutely gold. Okay. They love their own bodies so much. Every part of their body is important. They love playing with their private parts whenever you do diaper changes. They love playing with their own dookie because it's amazing. Even their poop is fantastic. Okay. They think they are literally the best on the planet. So your goal is to serve me, and that is all. Thank you. Me. Do you understand?
Yes.
Okay. So autonomy versus shame and doubt means if you don't allow them to try things, if you have a helicopter parent that tries to prevent them from hurting them, don't stand on there, don't do this, they will never learn to exert their own selves, and they will never learn to be independent people. So what does this look like in adulthood if you never progress through autonomy versus shame and doubt?
You're dependent on your partner.
You're dependent on your parent.
And insecure.
You usually don't get a partner because your mommy or your daddy does everything for you, right? They register you for school, like, college, and they're going to help you do everything in college, and you are dependent on them for literally everything. You don't know how to do anything on your own. Make a doctor's appointment. I don't know how to do that. Ma'am, you're 25. My mom will do it. They never learn to do things on their own, and they feel that they are literally incapable of doing it on their own because their parent always did it for them. Now, when their parent does it for them, that doesn't show that they love their child. That to their child conveys the message of, I don't trust you to do this. I don't think you can do this. So I have to do it for you. But then they never can get out of that stage. Do you understand?
Yeah.
So for toddlers, we let them try everything, even if it's dangerous. And I'm not going to let them, run around with a knife. But if they're climbing up on something like at a playground, I mean, they will learn. I can say, like, be careful. But if you try to hold them back, have you ever tried to take a toddler away from anything? It's like, it's like personally insulting. Like, I was climbing that and you took me off, like, and they'll throw a giant fit because it's not fair, right? Let me try, All right, Piaget's. There's actually 2 Piaget stages here. Sensory motor until they're 2 or 24 months. And y'all know what sensory motor is because we already covered it. Yes. Okay. And then we're going to move over to pre-operational. Do you know what pre-operational means?
Like figuring out how things work.
They're trying to, they can actually understand a little bit of somebody else's perspective, but not really. Like they can understand that other people are here, but I don't really want to take your opinions into account. And I still see very black and white. Okay. So for instance, in the pre-operational stage, you are 2. Okay. And your mom says, we're going to go pick up your brother from soccer. And then we're going to go get some ice cream. Okay. Mom's 9 months pregnant. So you go pick up brother from soccer. Okay. And the 2-year-old knows it's ice cream time. Mom said it, right? Mom all of a sudden goes into labor in the car and they're like, oh, we got to go to the hospital. Now, what does toddler say?
What about the ice cream?
Where's the ice cream? No, mommy's going to have a baby like right now. Yes, that ice cream. Like they cannot take into account other people's perceptions. They see everything through their own lens. So every single thing that happens is how they perceive it. They can't understand, like it's developmentally incomparable. Like they cannot see that you have a different perspective. So that's another reason why I think it's frustrating for them and why they have like tantrums, because they think that you think exactly like them. Okay. I wanted the red cup. Now I don't. Why do you not get that? Now I'm gonna throw a fit because you gave me the red cup I asked for. How do you not understand that? Right. They cannot, because they can't see. I know it's really annoying. Okay. Kohlberg is pre-conventional. What does pre-conventional mean? Well, what was Kohlberg's? Don't know Kohlberg's, sorry.
No.
Oh, Kohlberg's is the moral standards, like the morality and like how they perceive the world as far as good and bad, right and wrong, yada, yada. So there wasn't one for infants because
They have none.
yeah, we don't know anything about that, you know? So pre-conventional and Kohlberg, basically this means that things are good or bad, but only from their perspective, right? They don't have any, like if somebody steals, you know, I'm not saying like a toddler would think this, but just so you understand the concept, like somebody steals a loaf of bread, that's wrong. I don't care that they were trying to feed their family. Like I can't take that in consideration. It's wrong, right? You can't do that. That's a no, right? But they only perceive anything that's good or bad through their own lens. So for instance, if you're my mommy and I love you very much and we have a very good relationship, right? And I asked you for a cookie and you said no, I hate you, mommy. I hate you. And I would hit you and I would kick and because I hate you, right? In this moment, I literally hate you. Now, because they can't take into consideration, like, but she feeds me every day and they cannot do that, right? Do you understand what I'm saying?
Yeah.
So like trying to make kids this age be grateful, never going to happen. And say, thank you, not going to happen. Trying to make kids this age share is ridiculous and way developmentally inappropriate. Toddlers do not have the capacity to share. And it's a very odd concept if you really think about it, okay? Because first of all, they have their mirror, right? So if somebody tries to come over their mirror, absolutely not, right? Okay, so first of all, and they can only see themselves. So how can you explain to a toddler why sharing is nice, right? That would expect them to be able to take into account somebody else's feelings. And they can't. They literally developmentally cannot do that. So when you tell a kid they have to share something that they have, they're going to tantrum. That is absolutely normal because mine, that was mine. And then you came over my mirror and you took it from me. I can't take into account like he really wants to play with this. And sharing, I'm sorry, it's weird. If you really think about it, like, see that Powerade you have? I want that. Give it to me. I want it. No, I'm serious. I want your Powerade.
Oh, like
yes, I asked for it. So please give it to me.
I don't know if this was a part of the thing, but okay.
I like your necklace. I'd like to have that. But do you see what I mean? It's weird that we like something that this kid is playing with and enjoying. You're literally telling him, I'm going to take it from you, even though it's yours, and give it to this other kid just because they said they liked it. We don't do that as adults. Like, oh, I like your hair tie. Can you just give it to me? Like, why would you expect a child who developmentally can't even understand that share? I do not believe in sharing in any kind of way. Okay. What I do believe is in when he's done, you can use it. Okay. And that's fine. But to take something from another child and expect them not to tantrum is absolutely insane. I'll give this back because I'm not a toddler. Okay. But do you understand how sharing is absolutely developmentally unbelievably ridiculous?
It makes like so much sense.
So
But-
then what do they do in like elementary schools when they get onto the kids because they don't know how to share with other kids?
What do you mean they don't know how to share?
Well, the teachers will be like, oh, you're supposed to share, and they'll like discipline them. Like, oh, they'll like get a red card or something because they didn't share
Oh, I
their
understand what you're
toys.
saying. At school, I have absolutely no control over what happens to my kid at school. It is wildly developmentally inappropriate. So are the those color charts that you're talking about. Absolutely ridiculous. You're punishing a kid for, and then like publicly shaming them. That's basically what the charts are for. I'm hoping I can publicly shame you enough to make you do exactly what I want you to do, which is developmentally inappropriate anyway, to expect a child that's 6 years old to sit at a desk all day. Children are not meant to do that, right? So those reward charts and all of that, absolutely insanely developmentally inappropriate and completely stupid, because it punishes the kids who are just movers. They're movers, you know, they want to move, and kids naturally need to move, right? So basically it's a shame based. It's not a rewards based, it's shame based, not developmentally appropriate. Kids they don't have to learn how to share. You naturally will like give something to someone if you care about them and you like them and you're done with that item. Nobody just gives their shit over. Like nobody does that, right? Like if I'm eating a meal or something like that, say you and I are eating together, like, oh, that looks good. Like, yeah, okay, here, you can have some. I wouldn't hand over my whole plate and be like, well, I guess I don't get to eat now. Do you see what I mean?
Yeah.
So like what you expect out of them is ridiculous. And what are you expecting them to share anyway? What are they supposed to share? In elementary school, like what?
Like toys, I guess. I don't know.
Why do they have to share toys when they're playing with it?
I don't know.
That's what I'm saying. It doesn't make
Yeah.
sense. You'll see how like that, none of that makes sense. So no, I never teach my kids to share. Like when they're done with that item, then somebody else can come and play with it. You'll see what, yeah. Okay. All right. Okay. That is pre-conventional. We understand.
Yes.
All right. Weight quadruples by 2.5 years. Okay. Now growth is way going to slow down here. So they're only going to increase their height by about 3 inches a year. Head circumference is still equal to the chest circumference. Remember, it has to be to balance them out, right? They're going to have big bellies and bow-legged, right? Big head, big belly, bow-legged. And that's totally normal. Like a little bobblehead. Yeah. Okay. Tantrums, perfectly normal because they don't have verbal skills yet. They can only put 2 words together. I mean, there's a lot of emotions for just putting 2 words together. Can you imagine like you're like super upset, school sucks, you know, like that's all you can say. So like that, it's frustrating for them because they can't like get their words out. So they act out. Perfectly normal. Tantrums are very healthy. They're a good way for us to get out emotions, right? Perfectly fine. They don't have impulse control either, right? So if they want something and they want to take it and then they're told no, then that hurts their feelings because why would you do that to me? Do you not realize I am like the golden child, right? So it hurts them. Breath holding is very common. That's their way of controlling their environment. So controlling their environment, very important. Okay. So they'll hold their breath and then you don't have to panic about it. Just wait till they pass out and then they will come to. I am serious. I mean, if you want to blow in their face, you can, but yeah, like eventually, I mean, they'll get mad. And you're like, okay, get at it. So it's like, I don't care because eventually they're just going to, and then their body will naturally breathe. You know, it's a phase that they're going to go through. Visual acuity is, they're abdominal breathers too, just so you know, they breathe with their bellies, right? It's like a big old giant. Yeah. Visual acuity is at 2040. So their eyes are still developing. Yeah. Negativism, very common. Everything is no, even if they mean yes. Okay. Because they've just learned no and they know what it means. And you've been telling them no for 3 months. And so now I know I can say it back to you. Okay. So anything that they want, they're going to say no, even if they absolutely want it. Okay. So they could be very upset. No. Do you need a hug from mommy? No. You know, but they're not going to say yes, right? They're just going to say no. So they may say like they don't want something when they really do want something and vice versa. Okay. Because honestly, they're conflicted and they don't know what they want. We all feel that way sometimes too. You just don't have the like language to say like, I'm sad and I'm happy at the same time, right? I love you, but I also hate you. Like, you know, okay. So everything is just no, negative, hate it. All right. Fine motor, easy to remember. So on fine motor, when they are 1 year olds, okay, they can draw like one body part, like one thing, like they'll draw like, you know, or a scribble. Okay. When they're 2, they can put 2 lines together. So like a head and a body or an X or a plus. You see 2 lines. Okay. When they're 3, they can do 3 points, right? So they can do like a head, a body, and arms, or a triangle because it has 3 points. Easy enough?
Yes.
Okay. Language, we already said, works the same way, right? 1, they put 1 word at a time. Doesn't mean they just have 1 word in their vocabulary. You'll understand that. But they can only say 1 word at a time. 2, they put 2 words together. 3 words together. At 4, they never stop talking. All right. We already said they have big heads, beer bellies, and bow-legged. Okay. Yeah. All right. Play. So at this age, they do start to mimic what you do. They copy everything that you say. So please watch out what you say because they will repeat it. Okay. When I say mimic household chores, like if you're wiping down something, they want to wipe down something, right? Because they want to do it themselves. Me, I do. Because that gives them confidence when they're able to accomplish something. They're very sensory at this age. So lots of stuff with their hands, like, finger paint and slime, anything that sensory play is very, very good for them. Bonnie loves the shit out of finger puppets. I'm just gonna tell you, if you see toddlers, it's finger puppets. Toddlers, pick it every time. I've never even really used a finger puppet in my whole entire life, but like it is very big at this age. Finger puppets. Okay, so toddlers, finger puppets. Okay, finger paint, push pull toys. So like those are the ones that they can actually like. But ones I showed you on the 12-month, where they can push, behind it. Yeah, or things that they can pull, like a wagon. Okay, so they like things that they can be mobile with because they're very mobile at this age, right? And they want to move. Okay. Gender roles. So they tend to identify with the same sex parent and they don't want the other one. So they get parental preferences at this age, which hurts the other one's feelings. Okay. Typically, this doesn't always work out that way, but usually, just reassure the other parent that is not the liked one right now. It will come back around. It's just kind of the way that it is for a while. Okay. Ritualism is very common. What's ritualism?
They're used to doing things over and over
Yes, they
again.
want the same schedule. So thrive off of schedule. Toddler schedule, very important. Okay, their schedule, toddler moms will live and die by the schedule. Because if you get off the schedule, the toddler's like, and they lose their shit. Yeah, kind of like that. Not so much like the lining up of stuff like that, like autism, but yes, they do thrive on a schedule. Okay, especially if they're in the hospital, we keep toddlers on the same schedule as they were at home. Okay, because you got to think like it's got to be very hard for a toddler. I mean, you're a year and a half old, you really can't do a whole lot. You have to ask for help for everything. You have no idea what your day is like, right? You don't know where you're going or when. Your mom puts you in the car, you're strapped into a car seat, have no idea where you're going to end up. You fall asleep, you wake up in a different spot. Like that's kind of scary, so they thrive on knowing what comes next. Okay. They're not supposed to have any electronics at all until 2 years, which is funny when like people put their babies in front of a TV. I'm like, they can't see it anyway. Like, you know what I mean? Like they can't see that far. They can't see colors. Like what's the point? Yes, I don't really need it. They are what we call the great mimickers. They're little parrots. They will do exactly what you say, exactly what you do. They're mimicking every single thing that you do. Okay. Yes. All right. They need to go to the dentist every 6 months. Control. This is very important. I put it in a cloud. They develop control of bowel and bladder at around 18 months. Now, are most 18 months toilet trained? Absolutely not. Okay. But that is the point in time at which they physiologically can actually do that. Not toilet trained, but physiologically can hold it or even feel that they can go. Now, the reason why that is so important, most of my abuse cases that I saw were between, like, say, 12 months and 18 months, because they thought that child should be toilet trained. So every time they peed on themselves, which they physiologically could not hold, they would beat the shit out of the kid. Okay. So it is very important to let the parents know, like, there is no bowel and bladder control. They cannot even feel it until they're at least 18 months. But most kids are not ready for toilet training until they're 2 or 3 years of age.
Is there any way to like fix like a child's ability to like control their bowel movements?
What do you mean?
Because I had this patient whenever I was volunteering that she had no control over her like bowel movements because she was sexually abused like repeatedly for
like anally sexually abused?
Yeah.
Okay, then they would have to probably do surgery for that. There's lots of different reasons why kids can't hold their stool, so it would depend on the reason why. Like a lot of kids with imperforate anus end up being incontinent for the rest of their life. Amy's not, thank God. But there's all different reasons for that. Constipation, chronic constipation can make them have encapresis, which means they poop themselves and they can't control it because you stretch out those nerves so much that you don't even feel the need to go anymore. So there is lots of reasons why. Most of them can be fixed, but you would need to know the reason why. Okay. All right, so you understand they do not develop control of bowel and bladder until 18 months.
Yes.
But that is not, most kids are not ready at all for toilet training at that point. Okay, you wait till the kid is ready.
Yes.
Okay. You cannot make a kid pee or poop, and that is a control move. And if toddlers are already like, I want control, and then you're trying to force them to sit on a toilet, it will never work out for you until they are ready to do it. You can try every single tool in the book, but control of bowel and bladder is ultimately up to your kid. And if they're peeing on things, they're doing it out of control. Okay, because that is one of the only things they can control, which they can feel it. They can control that, right? You can't make me do that. Like you can't, that and sleep, right? So they will not sleep. or they'll pee and poop on everything because screw you. That's the only thing I can control. You tell me everything else. You fix what I want, or you fix what I don't want for food, right? You tell me where to go and when to go. And like, that's the only thing they got. Do you see what I mean? All right. Finger puppets, really big deal, guys. Really, really big deal there. All right. This is the age of parallel play. What is parallel play?
You play along the side of the kid, but you don't play together.
Yeah, because their mirrors got to touch, right? Yeah. So you like have this toddler with this mirror and you got this toddler with this mirror and they'll play next to each other, but they're not going to play with each other because this is mine and this is yours. Right. And if all they can see is themselves, then those mirrors will just beep and they can't play together. So they're going to play next to each other. Okay. Nightmares versus sleep or night terrors. What's the difference between night terrors and nightmares?
Terrors is when they like actually like wake up and
They do not wake up.
no.
They appear to be awake, but they are absolutely not awake. It's very creepy. So they will wake up screaming. This usually happens more to toddlers. So night terrors happens more to toddlers. Nightmares happens more to preschoolers because preschoolers have all this imagination and stuff, and that shows up in their dreams. Night terrors happen very soon after you put the kid to bed, and they will wake up and be screaming. Their eyes are open, but they're actually asleep, and they scream and they scream and they scream and they scream for hours at a time. And it does not matter what you do because they are not awake. You cannot console them. Super creepy. They will not remember it. There is no nightmare associated with it. They just wake up and scream for hours at a time.
What if they just like sit up but they're still asleep? Like, is it still considered a terror? Like, do
Are they
have to
crying?
sleep? No.
Oh, then no, they're just probably sleepwalking or something.
Okay.
And then nightmares, like they actually wake up and they are scared and you have to console them and you can get them back to sleep. What are you laughing at?
Okay, so like there's like a myth, and they say that you can't wake up like a person that's sleepwalking because they'll get a heart attack.
Oh, yeah,
They'll, like,
that's not
freak
true.
out.
They may
Really?
freak out, but that's
Oh.
because they went to sleep one place and they're waking up a
Or
different
they're
place.
waking up and someone's like shaking them. Like, that would
Yeah,
scare
that's
me.
scary.
Yeah.
Yeah, but no, they will not have a, oh,
Okay.
ma'am, they will not have a heart attack and die. Okay,
I was dumb and I was like, that's not right, but I just wanted to say it.
I'm glad we have dispelled many myths today. All right, make sure you put them to bed awake. We just talked about that. Oh, regression is very common. What is regression?
Go backwards.
Yeah, so maybe they were toilet trained and then all of a sudden you get a new sibling, right? Mom had a baby and then, yeah, or they ask for a bottle or they want to cuddle with mommy, like all these things. That's perfectly normal. Nutrition changes to 102 kilocalories per kilo. What were infants?
108.
Good job. They become very picky eaters. They may want only macaroni and cheese for breakfast, lunch, and dinner for 6 weeks. And then all of a sudden you serve them macaroni and cheese again because it is week 7 and I hate macaroni and cheese. How did you not know that?
Yeah.
Mhm. Then you switch to different food. Now, I'm not fighting at mealtimes. I will never fight a kid at mealtimes because what they eat is controlled by them and I cannot force feed a child, right? So peeing and pooping, eating and sleeping are the only things that they can control and they will. So mealtime is not worth the battle. So will I continue to give you macaroni and cheese, breakfast, lunch, and dinner? Absolutely. Will I continue to offer you different things with that meal? Absolutely. Sometimes they eat it, sometimes they won't. I will not, I do not care. Okay. But controlling what your kid eats is really kind of gross. Okay. And it sets them up for major food issues later. Like you have to clear your plate before, my parents always used to do that. And so we never learned to like feel when we were full. So we overeat, right? Because you're used to like, okay, well, I have to stuff myself full. You don't learn to trust your body and realize like, I can feel when I'm full and I'm done. Right. So that's one thing. Second of all, this whole, like, you have to eat your vegetables before you, no, I do not care. The kid will not die without the asparagus that you tried to serve him. Okay. Like, just let it go. Okay. Meal times are not the time to have a fight. Keep them on a schedule. Now, babies, I don't agree with being on a schedule. Toddlers are schedule. They thrive on knowing what happens next. I get up, I get dressed, I go downstairs, I have breakfast, I go to daycare. I'm at daycare till this long. Like my mommy comes and picks me up. She's going to take me to the park. We're going to go home. Like they thrive on that. Do you understand?
Yes.
Okay. Did I miss anything on this page?
No.
No? No. Okay. You sure? Okay. All right, these months should go much faster, okay, because there's less things happening. Right then?
Okay.
All right. So your ages that you're going to have kids come in for their well visits is 15 months, 18 months, and then after that, they come in every year. So 2, 3, 4, 5, 6, 7, 8, 9, 10. Do we understand?
Yes.
Okay. So we already did 12-month-old, but kind of overlap into toddler, right? 12 months, infant, 1 year, toddler,
Yes.
36 months,
3.
Toddler,
Mhm.
3 years,
Oh.
preschool. Okay. All right. So 15-month-old. All right. These kids are so clumsy because they've just learned to walk, but they think they can do like anything, right? Because they think they're invincible. Yes. They are the golden child. They're the most amazing thing. So they walk and they run and they climb, they scribble all over everything. This is where they color on the walls because I have walls and they're white and I have a crayon and I'm going to color on it. Like they can't see anything different, right? Gross motor, they can kneel without support. I don't know why that's a big deal. I don't know. It's kind of stupid. They lose their balance because their heads are
Big.
and their bellies are,
Big.
yeah. And they're just, right. They can't like get it straight because they got to kind of figure this out, right? Fine motor. Now, this is why I put the little Fisher dude. They cast objects to the floor. Okay. So they throw things on the floor and then they go get it. And then they throw things on the floor and then they go get it. And they're like fishing all day long. And the parent can sit and throw a thing and the kid will go get it. And then they throw, it's like fetch with the dog. Okay. Yeah, exactly like that. Okay. So that's why I put him. And they also play what's called catch and release. Okay. So they will go and throw something, go retrieve it, and they'll either get rid of it and want something else thrown, or they'll bring it back to the parent. So they're consistently like, oh my God, this is the funnest game ever. They're little dogs. Okay. I'm so sorry. Okay. I will always draw cubes. So I drew cubes on all of these because they're ATI is big on cubes. So however many cubes that they can have is what you'll see on there, or how many they can stack. Okay. So 15 months, super clumsy, really like just awkward age. Like, look, this little kid just cracks me up. Look, like his pants are all weird and his shirt's not tucked in. And like, they're just little, like awkward, clumsy fallers. And everything that they say is no. Even if they mean yes, it's no. Okay. Do you want something to drink? No. Ice cream? No. Oh, ice cream. Yeah. But yeah, they will just say no to literally everything. Okay. They can hold 2 cubes and stack 2 blocks. Okay. They can't do much because they're super clumsy. Okay. And then they stack them, they knock them down. They stack them, they knock them down. They stack them, it's catch and release. Everything is go get it and stop it. And they'll repeat it over and over and over and over and over and over and over again. Okay. They only know about 4 to 6 words. Remember, they're only putting together 1 word at a time anyway, because we're still 1 technically. Right.
Yes.
It's like not even 1.5. It's like 1 in 3 months. Says no to,
Everything.
but they kiss everything they like. So you either get a no or a kiss. That's it. Okay. You'll see them kiss the mirror because they love themselves very much. So if they see a mirror and they see themselves in it, they're going to be kissing all over it. Okay. And then they get attached to objects like that too. So if it's a toy they like, they kiss that toy. If it's a person they like, they kiss that person. But their kisses are like open mouth. You know what I'm talking about? Yeah. Yeah. It's super gross. All right. They can use a cup. We should have no more bottle, no more house fire. Right. They can tolerate separation, but very short periods of time. Like mom can step into the kitchen and the kid cannot have a nervous breakdown, but she better come right back. Okay. Serving size, highlight serving size is 1 tablespoon per year of age. So this kid's only like 1 year, 3 months. So they should have like 1 tablespoon servings, 1 tablespoon of peas. That's not very much, y'all. It's really small. But that's of every serving of everything, strawberries or peas or whatever it is. Okay. And remember, continue to offer new foods. It takes kids 18 to 20 times of exposure to a new food before they will actually try it. It is so annoying. All right. And then I wrote your big choking foods here. Look at me, not your paper. What are your big choking foods? Hot dogs, grapes, hard candy, peanut butter, popcorn. Oh, y'all got them almost all of them, I think. Popcorn, carrots. Yeah.
Bread.
All right. So cut up all their food into very small. Did somebody say grass?
I thought it said grass, but it said grapes.
She's like, I got this. It's grass. Okay. Why did she like that? All right. Do we understand our 15-month-olds?
Yeah.
Little awkward, like just
Always falling.
Old men.
always falling. Yes. Say no to everything. Just leave me alone. I'm busy. Yeah.
Little old people.
Yeah. All right. 18 months. Okay. So they have control of bowel and bladder, but they're probably not ready to toilet train yet. Right. However, we get them ready for it. So we start talking about it. We start introducing it, but then you don't make them do it. You can put a potty in the room, but you don't say anything about it. Okay. You don't have to toilet train them because the more you push them to do it,
They won't do it.
yeah, because they're going to be like, she wants me to do this, damn it. And they want to do it. Still very picky eater, but they become more of a picky eater at 18 months and they get something called physiologic anorexia. It does not mean they're skinny. It just means there are periods of time where they just say, no, I don't want to eat it. No. Okay. A kid does not have the capacity to starve themselves. That is not a fight I want to die on. Okay. Just not let it go. Oh, you don't want to eat? Okay. But then you don't get a snack, right? And they're going to tantrum because they want a snack, right? But this is the meal time. So it's 3 meals and 2 snacks. And if you don't eat during meal, then you can wait till your snack. Okay. Gross motor, they can go to standing without support. So they can be sitting and they can stand like all the way like underneath their feet. Now, the reason 15 months they can do it, but they usually fall over because their heads are so big, they'll go, right? So they can go to standing like all the way and don't need any support, and they usually don't fall over. They can walk upstairs with assistance. They can hold your hand and they can go up the stairs. It's usually like foot, step together, and they use the same foot, you know what I'm talking about. They can jump in place with both feet. So they're not as clumsy, but they're still a little clumsy. They can start sitting in their own little chair, like their little daycare chair or whatever. Highlight throws a ball overhand. I don't know why they love this fun fact, but throwing a ball overhand is apparently a very big milestone, and we hit it at 18 months. Everything is mine. That mirror is very strong at 18 months. That's why it's not worth the toilet training fight. It's just not. Okay. They can start to use a spoon better than they did when they were a little bit younger. They can at least make some of the food into their mouth. Okay. They can stack about 3 or 4 cubes, say about 10 or more words, and point to a couple body parts, which would make sense because, you know, they have to know what their pee-pee is and stuff to go to the bathroom. They can take off their clothes, but they definitely cannot dress themselves. Okay. Because they don't have the dexterity to do that. Like buttons and zippers and stuff. That's not going to happen. This is the age of massive tantrums because everything is mine. So if you try to take something that is mine, even though it's probably not theirs, I mean, they could go and get like, a pill bottle, you know, like antidepressants or something, and it is theirs. It is mine, right? And if you try to take it from them, they're going to tantrum because it was mine. I found it. It's mine. Do you understand 18 months? Yeah. All right, let's go to 24 months. So now we're like 2. Like,
the terrible 2s?
Yeah, but 2s were not even the worst. Not even the worst. 3s were. 2s, it's rough because they don't have the language to like explain how they feel, and 3, it's rough because they do have the language to explain how they feel.
They start getting attitude.
Yeah.
That's what happened to my niece.
Yeah, and they can talk and talk and talk and talk, and everything at 3 is why. So it's like they'll why you to death. All right, so 24 months. We are 2 years old. You can start toilet training most kids. Now, I know boys take much longer to toilet train than girls, or they're not ready for a lot longer. And toddlers really like their body to be intact. So some of them will be creeped out by the toilet. Okay. Like Caden, I could get him to pee in the toilet because like once he peed in the toilet, it just like blends in with the water. Right. But pooping, that's part of their body. Their body has to be intact. You know, like they have boo-boos and you have to kiss their boo-boos, you know, and you need a Band-Aid because they need their body intact. So when they poop and they poop in the toilet, that is part of their body. And you are asking them to flush that into an unknown space. Caden would not poop in the toilet. And I'm like, go in the toilet. And I'm like, and then finally I was like, why will you not just go in the toilet? Because I knew he knew when he needed to go. And he's like, those my friends, and you flushed them down the toilet. Yeah, like it was part of his body. And like seeing it go down the toilet, he was like, it hurt him like inside. So he would not go. It was so annoying. He was almost 4 by the time he pooped. Y'all, it was really bad.
Wow.
Yeah. So anyway, those were his plans. So some of them, like it's easier to get them to pee potty train than it is to poop, but you'll know when they're ready because they go and hide when they poop first and foremost. Okay. They'll go behind a chair and like squat. Okay. And then they will take off their own diaper because they don't like being wet. Okay. They will wake up dry, like from a nap or something, telling me like, oh, you are able to hold it while you're in here. A lot of them like don't like the feeling of being wet or having poop. So they'll ask you to change their diaper. Like if you were at the point where you asking me, like, go in the toilet, you know what I mean? Yeah, it is time. So you'll see signs of potty training readiness. They should, or ideally can walk backwards. That's because you have to pull down your pants and then like walk a step backwards to the toilet. So we need them to be able to have some dexterity. Otherwise they'd have to pull down their pants, turn around and sit. And that's really hard for kids. Now it's better to toilet train a kid facing the opposite direction on the potty. Otherwise they're going to fall into the toilet. You know, the toilets are like shaped like an oval. And so if you try to put them on it, like you regularly would sit on it, a lot of times they'll like fall in. And if they fall into the hole one time, that's it. They're terrified forever and they're never going to do it. So there's like little potties you can put on the big potty, or you can get them their own little potty. But if you're going to send them on the big person potty, it's better to turn the kid around backwards. So like kind of straddling the toilet, and then put either like magnets or like get like window markers that they can like draw on the potty while they're just like sitting there doing their thing. Cause it may take a while for them to be able to go.
So like when you buy like their own little potty, you just like throw the nastiness outside, or what do you do?
No, ma'am, you put it in the toilet.
Flush it.
I know.
Oh my God, her neighbors are going to be like, she's at it again. She's putting her son's dookie in the front yard. The kids are trying to get on the school bus. Ma'am, I'm glad we're clearing this up.
It's only 3 months, so I'm learning everything.
Well, now you know you should not take it out in the backyard and dump a bunch of child's dookie. Okay, so you just pour it in the toilet and then it just it goes. Okay. All right then. So toilet training can begin. Language explodes at 2. And then these are the things that they can draw. Remember, 2 points together, right? So an X or a cross or like a head and a little body. Now that they are 2, we're going to go on 2% milk. This reminds me of a story. Did I ever tell you all the story about my student that came in here late?
The ears and the eyes and O's?
No, this is
The
one of
eyes and
the
O's, that was
best,
funny.
most hilarious story. I don't even know if I can, hold on. So there's a girl, she came to group sessions, but she also liked to do individual sessions. Okay. So she was late and she's never late. And I'm like calling her and I can't get a hold of her. So I'm like, what the hell? So she shows up and she walks and she's like covered in dirt. And I'm like, where? But I knew like she has like a ranch or whatever. So I was like, I think like, oh, maybe she like got caught up or whatever. And so I'm like, girl, you look tore up. She's like, I'm so sorry. Like I ran over here as fast as I could. Like I was running late. Something happened. And I was like, what happened? Y'all. Okay. I can't. Hold on. Okay.
I'm thinking like worst case scenario.
She started dating this new guy. Okay. And he at the time was living on this ranch in a trailer, like a temporary trailer or whatever. And you know, the plumbing's sort of weird in a trailer. And so he got up to, and he was like, I'm going to go to work. You're welcome to stay as long as you want. She's like, okay, I have a session at 10. Like, I'm just going to go. And he's like, well, you know, help yourself. My house is your house, yada, yada. We're so in love. And so he left. Well, as soon as he left, she's like, well, I waited till he left because I had to poop, you know? So she went to the toilet and she pooped after he left and the toilet would not flush. And she was like, it's a trailer and it had like some kind of manual, whatever thing. I don't know how it works. And she was like, I'm panicking because I really like this guy. We're like new and I cannot leave my shit in his toilet. Like there's no way I can do that. And I'm like, Alex, what did you do? She went and got a cup and fished it out of the toilet and took it to his backyard and buried it. And she's like, it took me 3 trips. I'm so sorry. And she's like, then I'd take a shower, but I was afraid to turn on the shower. So I'm just here. And I was like,
3 trips.
yes, 3 trips. And she buried her shit in his backyard.
Why would she tell you that?
We were very close, very, very close. So that happened. Anyways, so I can understand there might be some confusion. Okay. Fine motor. All right. So they can line up 2. I can't, y'all are going to need a minute. Okay. They can line up 2 cars, like 1, 2, because they are 2. All right. They can stack up to 6 cubes. Now they're getting a little more grown, you know. The big thing at this age is they're able to go upstairs by themselves. Okay, so that's why I put her on stairs and they're just super busy, right? So a lot of times toilet training is really hard because they're too busy, right? Like they have important things to do, right? And so I cannot stop and pee or poop because I am very busy doing my work right now, right? Because their play is their work. So they will not stop and go. They will say about 300 words. You see how we exploded? Look, at 18 months, we were saying 10 words. Now, yeah, so there's a huge language explosion, which is another reason why growth is going to slow during this time because the language is exploding. Okay. They can put 2 words together and they start using pronouns. So they can say like, I want this. Usually they say like me want, but now they can say I, or they can say you go and do this or whatever. They can help dress and undress now. And they follow 2-step instructions because they are 2. Okay. Physical exam. Now their chest circumference is actually growing bigger than their head circumference. We're starting to get a little more, you know, lateral is now greater than AP. So they're not a square anymore. And they remember we doubled their height to get to the adult height. Yeah. Okay. There was something else I was going to tell you. What did I miss? Oh, the lead screening. Okay. So at 2 years of age, we screen all the kids for lead. So especially if they lived in a house that was built before 1976, that hasn't changed because they use lead-based paint. Remember those grocery bags? I told you about those. Receipts are also lead. I don't know if y'all know that. Are lead-based. Pottery. So we do a lead screen when they come in for their 2-year visit. And then if they are positive on any of the stuff on the screen, then we run blood tests for lead. Now, lead is a heavy metal. It will build up in the brain, just like all heavy metals do. And it can cause major altered development, decreased intelligence lifelong, and seizures. So we do need to check it. Okay. So what it was before was greater than 5 was considered concerning, and greater than 10 lead level, we needed an intervention. CDC just changed that in 2021. I put it on here because it probably has not been changed in your course yet. That probably will not change till like 2031. But I'm just letting you know the new CDC recommendation is to is to consider greater than 3.5 a cause for concern. Pretty much anything you get from China, especially like the jelly shoes, or like shoes, a lot of the toys are lead based because they don't have any standards there, and they get shipped over here and they're very cheap, right? I mean, you can go, that's like dollar store stuff, right? The dollar store buys all their stuff from China because it's so cheap, but it is made with lead. And so you have to be really careful the toys that your kid plays with because they can be lead based. Okay. If it is greater than 45, we have to chelate them, which is very dangerous. We pull out their blood, we pull out the heavy metal. It is a very dangerous thing. So we don't do it unless we absolutely have to. Okay. But it is something we need to keep an eye on. Got it?
Yes.
All right. Questions on a 24-month-old?
And you pronounce it chelation?
Uh-huh. What do you think it was? No, ma'am.
Is that like
Okay.
similar to like dialysis? Like you're pulling out all the blood?
Yes, it's kind of like that, but it's sort of also like bloodletting. And there's lots of different ways that we can chelate. So it can be done lots of different ways.
Okay.
All right. Now this one is 36 months. Now, technically this is a preschooler, right? So this is basically like your crossover from toddler to preschool. Okay. But I did put, since I wrote 36 months, I did still put it in toddler, but realize like this is your typical 3-year-old, right? All right. They should be potty trained at this point. Okay. Now they can have 3 points of drawings. They can draw anything that has 3 different sides or parts to it. They speak in 3-word sentences. They can follow 3-step instructions. They can put 3 puzzle pieces together, and they ride a tricycle. Tri means
3.
we understand.
Yes.
Okay. This is where associative play begins. What were toddlers? What kind of play did toddlers do?
House.
Yes, but what was the name of the play? Parallel play, where this person plays and this person plays. Now the mirror is starting to come down. So now I realize, oh, damn, there's been a person next to me the whole time, right? And now, like, because the biggest thing, which you'll see in preschoolers in a minute, is magical thinking and play. Everything is like imagination based. So now I see you want to play with me, right? So their play is based on everything like role playing. They want to play kitchen and they want to play school and let's play grocery store, because now they have all these people that they never saw before because of the mirror. Do you understand?
Yes.
All right. So that's associative play. They also, if they don't have friends available readily, they just create their own because they want to play with somebody else because they have these big imaginations and they need other people to carry that out. Okay. So they want to play kitchen, they want to play house, and they want to do any chores that you have, which is so funny because now all the toys that they're having coming out for this age group, they are, but now Dyson came out with one that said like, because they make like these fake little kids vacuum cleaners, one that actually vacuums. So then like your kid is like playing, but they're actually like, yes.
Well, they've made like really intense, like some people can like, they have like legit houses for their kids, and they'll have like dishes, and they'll have like a whole kitchen, and
they're like,
can
do your
cook,
work.
Yeah. And they'll be like, go like clean, and they'll go clean because they'll have a broom and a vacuum and everything and a mop.
That's very cute. I need to do
And
that
they'll really
like
have
right
their
now for
kid
my
do
children.
everything because the kid wants to. So it's like, go do it. Bye.
I mean,
go take the trash out.
by all means. All right. They usually have a lovey or a doll. You're going to do everything on this kid's doll or like stuffed animal before you do it on them. Because if they see you do it on the doll or the stuffed animal and that doll or stuffed animal lived, they will live too when you do it to them.
Okay.
Do you understand?
Yeah.
Okay. Nightmares may begin at this time. How come? Their imagination is huge. And they want to mimic and do every single thing that you do. I'll do it with you. I'll do it with you, mommy. I'm going to try. Now they can start to take turns because remember the mirror came down. They're like, oh, hello, other people in this world, right? And they start to develop relationships with other people. Now that I care about you, I want to share with you because it makes you happy, right? They can stand on one foot and now they can dress themselves. So they're starting to like even out a little bit. So they're not the big bobbleheads anymore. Still a little bit. Okay. Play is everything like magical thinking and imaginations. They'll play kitchen. They want to play house. They want to make believe. They can play with their dolls, right? They like to do like painting. I'm going to pretend I'm an artist, right? Play-Doh is really big at this age. We don't do it in really like younger toddlers because they eat it. They don't even care that it tastes salty. Yeah. But like a 3-year-old should be able to. No more naps, which is horrifying. And they will ask, why? How come? Why? Why that? Why? But why? Why? And you'll just go into this never ending cycle of why. All right. All right. Do we understand 36 months, AKA very beginning of preschool?
Yes.
All right. Give me just a minute so we can start the new